it's been almost 2 weeks now since President Donald Trump took office, and within days, the president ordered the removal of any terminology on federal government websites that promote gender ideology. And as of Friday afternoon, several federal websites tracking climate science and health care issues like HIV prevention and transgender care were down. These include the agency's HIV testing page and national reports, among others. I want to bring in Dr. Stephen Thomas now to talk more about this and the impact. Dr. Thomas, you are a professor of health and policy and management at the University of Maryland. We want to first thank you so much for taking a moment out of your Sunday to join us. How concerning are these actions, especially among public health experts and advocates for the LGBTQ plus and science community?
Well, first of all, thank you very much for giving me the opportunity to share some observations with you today on what can only be described as something that is unprecedented. All the communities that you just mentioned, the very specific groups are impacted, but we as a whole, as a nation, are impacted. We are blind without the essential service of understanding health data. And so I think that this comes as close to a five-alarm fire as I can imagine in the public health world. And one of the challenges with public health is that it's invisible until something goes wrong, be it a pandemic, be it the fentanyl addiction and deaths, be it simply monitoring when the next food outbreak will be. So now America is waking up to the importance of public health and the importance of the data streams that our scientists, our health professionals rely upon to keep us healthy as a nation. We are all interconnected. And for this polarization, weaponization, call it what you will, to occur in the arena of health and wellness should be a wake-up call for us all. And maybe it will be an opportunity for us to strengthen our data systems. Right now, there are researchers at Harvard University at the Chan School of Public Health actually holding marathons to try to capture and restore the data and making sure that it's not lost. So this is a very serious moment that we're in right now.
It seems.
And I think that I'm just so glad that you're bringing this attention to your listeners this morning.
It seems like it could create a dangerous gap here. How do you believe these actions will influence, especially when it comes to like public trust? These are federal health agencies, as you mentioned, with data, evidence-based information that, of course, many doctors in every corner of our country rely on as far as guidelines for treatment and antibiotics and so on. So how does this affect the public trust?
You know, I have I have mud on my boots. I say that because I've been on the front line of the COVID pandemics, um, and I saw firsthand what it meant when communities did not trust information coming from our health systems. And we've all went through that together. We all experienced a pandemic. For me, it's my second one. My career began during the time of the AIDS pandemic, and now I'm living through the COVID pandemic. So trust is it's so vulnerable right now, not only in our government agencies writ large, but in health in particular. And the Centers for Disease Control and Prevention, let's get the whole name, the Center for Disease Control and Prevention, historically was one of the most trusted federal agencies in the nation. And it took some big hits during the pandemic. And the effort to recover that community trust is really on the line right now. And I think that medical professionals around the country, public health professionals are truly concerned that we are flying blind if we're not able to access the actual data being collected by our federal agencies. Keyword here, federal agencies. So uh, this is how we invest in ensuring that everyone is protected.
Right.
We are all interconnected in ways that disease does not have any boundaries,
And
especially
as
infectious.
We have to end it there. I'm so sorry, Dr. Stephen Thomas, but as you mentioned, this is unprecedented. So we will all wait and see how this affects our society as we see this shift. I know you're going to be joining us again in our next half hour, talking more about this new drug. We will see you then, Dr. Stephen Thomas, Professor of Health Policy and Management at the University of Maryland. We thank you for your time for now. We'll see you in a few.